If your ear suddenly starts hurting, feels blocked, itchy after swimming or cleaning your ear, you probably have outer ear infection, also known as swimmer's ear. And you can check it right now. If you pressing your tragus or pulling your ear gently and the pain increases, this video definitely is for you. My name is Daria, I am an ENT specialist, and today I will show you how to treat swimmer's ear properly without unnecessary medication based on international evidence-based guidelines, not myths. Why it's important? Because more than 50% of patients still receive overly aggressive and completely unnecessary treatments, oral antibiotics, which are less effective, increase recurrence, and can cause side effects and long-term consequences. Outer ear infection or swimmer's ear is inflammation of the skin of your ear canal, and it mostly happen because of bacteria, and most cases happen because excess moisture and micro injuries of the skin. Explaining details about why it's happened, why it risk, and how to prevent it in separate video. Now let's focus how to treat it properly. What do international guidelines say? Oral antibiotics are not recommended for uncomplicated outer ear infection, and it's a strong recommendation, which means the harms clearly exceed the benefits. Because most commonly prescribed antibiotics not work against Pseudomonas, the most frequent cause of outer ear infection. They also don't reach the therapeutic concentration in the ear, do not really improve the course of disease, and even can increase the risk of recurrence. They also increase the risk of side effects like nausea, vomiting, gut microbiome disruption, and contribute to antibiotic resistance. So the harm clearly exceeds the benefit. Outer ear infection responds extremely well to topical therapy, which achieves high local concentration and works much better, and it's scientifically proven. So in 80 till 90% of cases, oral antibiotics are simply not needed, they are unjustified and potentially harmful. There are very specific cases where oral antibiotics may be needed in high-risk patients like diabetes or immunodeficiency, or who undergo chemotherapy, or elderly people with severe pain or swelling, and complicated cases. So for everyone else, topical therapy only, which is safe, effective, and proven. So what is the evidence-based treatment for outer ear infection? It's a topical therapy, eardrops or cream, and cleaning of your ear canal. When we talk about eardrops as the first-line treatment, guidelines recommend using antibiotics and steroid, or antiseptic and steroid eardrops or cream. Steroids help to reduce swelling and pain faster, and antibiotics kill the bacteria. Here is a common combination used worldwide. When we talk about clearing the ear canal, it's really important because the eardrops will not work if the ear canal is blocked by debris or inflammation, discharge, or dead skin or earwax plaque, and it's really commonly happen. So the cleaning may include suction or careful irrigation if the eardrum is intact, or dry mopping. And this step will dramatically increase the treatment success, because if there is any inflammation discharge that will be left here, it can increase the risk of recurrence. When we talk about pain management, it's important because outer ear infection, the pain is intense and severe, and it's important to know even with proper treatment, the pain still can continue for 2 or 3 days, and it's normal because the inflammation already started and we can't just disrupt it with treatment. Guidelines recommend use non-steroid painkillers and paracetamol. Also important part of recovery is to keep your ear dry. No diving, no swimming, and when you go shower, just close your ear with cotton covered with oil or Vaseline. And if symptoms not improve in 48 to 72 hours, the guidelines advise repeat examination, check for blockage, assess correct use of drops, rule out fungal infection, and consider a week if the ear canal is too swollen for drops to enter. Swimmer's ear is extremely common and very easy to treat if you do it right. Topical treatment, ear cleaning, and keep your ear dry. That's the evidence-based approach. Avoid unnecessary antibiotics and stay healthy.